In today's training, we will talk about Medicare covers behavior health. And I'm going to share with you in general information, a general overview regarding the benefits that Medicare will offer. So let's start off talking about behavioral health and how it is viewed. And we basically can describe it as a connection between behaviors and health and the well-being of the body, mind, and the spirit. And there are many definitions, but this one seems to be very clear and just beginning to think about what behavioral health is. As I mentioned, Medicare covers an umbrella of services and programs to diagnose and treat mental health as well as addiction-related issues. So let's break it down in terms of what that looks like. Mental health issues or illnesses may include depression, anxiety, bipolar, or psychosis. As some of our addiction-related issues may include opioids, which is a real conversation in our society today, alcoholism, gambling, and sex. All of those are addictions that people are confronted with and have to resolve. Medicare does cover those behavioral health issues, and it's covered under Part A, Part B, Part C, and Part D. And so this training today is going to look at some of the various areas under each of those parts for Medicare. So Medicare Part A covers the inpatient care that goes with in a psychiatric hospital, a general hospital, or it could be a facility stay that may be more of a short-term recovery issue. Part A, you must meet a yearly deductible before inpatient care is even covered by Medicare. The cost for each benefit period will differ, and we'll talk a little bit about that. Medicare pays for the full cost of the first 60 days after deductible. So you need to know what's involved in terms of what you pay and what Medicare will cover. Days 61 through 90, Medicare pays, and then you as the beneficiary will pay a daily co-insurance. And for the first 60 lifetime reserve days, Medicare pays part, and then again, you as the beneficiary will pay a daily co-insurance. And that's the general overview of what Medicare will do as it relates to the Part A coverage. Now, let's go to Part B. As the contrary, Part B will cover the outpatient care, partial hospitalizations, and it also will cover mental health treatment. Remember, for Medicare Part B, if you have original Medicare, you will pay the 20% co-insurance after meeting your Part B deductible. So there's a Part A deductible and a Part B deductible as well. Medicare Part B, as you're getting treatment for whatever the behavioral health condition may be or the addiction may be, Medicare Part B will provide individual and or group therapy, activity therapies, and that may include art, dance, music. It can also provide training and education, and certainly family counseling may be a major issue. It looks at lab tests, alcohol, as well as depression screenings. So Part B will cover a myriad of different activities that help with addiction. or behavioral health therapies depending upon what's needed. And certainly these therapies must be as part of a plan of care as recommended or provided by your physician. Now moving on to Part C. Remember earlier on in the presentation, we indicated that behavioral health, Medicare would cover it under Part A, B, C, and D. And now for Part C or Medicare Advantage will cover Part A, B, and D. And for the beneficiary, they must contact the plan for behavioral health in-network providers in order to see who you have to work with according to your Medicare Advantage plan. And Part D, very simplistic, will cover drugs for mental health treatment. With behavioral health under Medicare, there are certainly certain requirements that you must meet in order to be eligible for your services. To share a few with you, your provider must state that your services certainly are medically necessary. Your provider must set up your plan of care, which I alluded to sort of previously. You must receive services from a provider who is Medicare certified and takes assignments. And remember, co-pays, co-insurances, and deductibles will apply. So what type of providers would you be working with? And there's a whole group of persons: your general practitioners, your nurse practitioners, your physician assistants, certainly psychiatrists, and then we have your clinical psychologists, your clinical social workers, and your clinical nurse specialists. There's a whole group of professionals that can provide services under this Medicare umbrella. So let's talk about key points that I think is important for you to remember as we look at how Medicare covers behavioral health. Number one, Medicare will cover mental health illnesses and addiction-related issues. Point number two, Part A deductible and cost sharing applies to the inpatient care. We covered that early on. Part B deductible and co-insurance applies to outpatient care. And point number four, Medicare will cover up to 190 days of inpatient care. Additional days may be covered in a general hospital. Point number five, Medicare Advantage plans must cover the same services. However, costs and restrictions will vary. Key point number six, you must be enrolled in a Medicare Part D drug plan or have a set of benefits included in your Medicare Advantage plan. Point seven, all services must be deemed medically necessary. And I really wanted to hit home on that in the previous slide, as well as cover it again. And our last point, number 8, all services must be delivered by a Medicare provider. And this is hopefully just to kind of refresh some of the slides that we presented previously. So in conclusion, we certainly want to let you know that we appreciate your time in this training and realize that you are somebody who wants to make a difference. So we thank you for attending this training and certainly hope that you will tune in again.